If we are to improve treatment access, we must also improve pediatric testing and identify innovations to improve the efficiency and effectiveness of diagnostic technologies. This technology offers the ability to rapidly diagnose HIV in infants. It can also measure HIV viral load, and it can detect the presence of TB or diagnose HPV, the cause of cervical cancer, using a testing platform that is simple enough for providers to use at the point of care. Recently, these same testing platforms have been used for the diagnosis of SARS-CoV-2 and the virus that caused COVID-19. In addition to improving linkage to care, this point-of-care technology can save costs and offer a set of diagnostic options that were once unimaginable.
Hello everyone, and welcome to the satellite session. My name is Alex Costa, and I work for the HIV section at UNICEF headquarters in New York, where I lead the diagnostics work. The big picture perspective of multi-disease diagnostics is that it shows a significant impact on 3 levels: technology and innovations, clinical care, and health system strengthening. The technology used for multi-disease diagnostics offers the opportunity to test for several diseases, but it can also improve the level of preparedness for outbreaks such as COVID-19. This is the stage for presentations by our guests today. We're going to start with Aaron Mdolo from UNICEF Malawi, followed by our colleagues in the Ministry of Health in Malawi, Brown Chimwandila and Dr. Kuzani Mbendera. And we're going to close with remarks by Unitate given by Smilka Delusini. The information they're going to present here is based on a multi-partner project that has been funded by Unitate and implemented by CHAI, ASLM, EGPEF, and UNICEF. I hope you enjoy it.
Accessing diagnostics services in Malawi has been a challenge for a long time. A long turnaround time, poor sample transportation system. These have been around for a very long time. Turnaround time can go up to over 1 month, which is not good. Timely testing and clinical decision is very, very critical to ensure good patient outcomes, not only for HIV, but even other diseases such as TB, HPV, and viral hepatitis. The coming in of multiplex disease testing equipment is very timely because it has helped us to fasten the diagnosis of these diseases. And the coming in of this technology was not only the technological part, but it meant different disease-specific programs come together to talk and collaborate. This is the task at hand. Working together, we have demonstrated that when all these diseases are tested using the same equipment, there's no negative impact to any of these programs. With me here are 2 colleagues from the Ministry of Health who wants to share our experience on how this worked in Malawi.
The HIV treatment program in the Ministry of Health in Malawi for some time in the recent years was dogged by a serious challenge in its early infant diagnosis program, which was a long turnaround time of results. Remember, EID is very crucial. Early infant diagnosis is very crucial because if you don't take action timely on kids that are born with HIV or maybe that get infected quite early, you are likely to lose up to 30% of them before their first birthday and up to 50% of them before their second birthday. So it was really that big problem to have results only getting back after so many months, until we took a pilot, which was to integrate EID testing and viral testing as well on our GeneXpert platforms. So integrating TB testing, which is already happening on GeneXpert with HIV samples, that's namely EID and viral load. We saw a significant improvement in TAT with the integration pilot. And even in data, we saw a 24% jump in pediatric enrollments of kids that are studying HIV treatment with a positive DNA PCR test result. The improvement was quite remarkable with the integration model. And we've moved on to even accommodate a lot more samples, so viral load for HIV and even HPV for diagnosis of cervical cancer is also starting to happen on our GeneXpert platforms. Moving forward, we look at a future of serious cost savings, efficient integration with use of this SmartPlex technology called GeneXpert to test multiple types of samples and getting results to patients on time.
As I was discussing diagnostic integration with Dr. Kuzani from the TB program in Malawi, there are a number of considerations to prepare the health systems of a country to integrate diagnostics, such as human resources, supply chain, biosafety issues, and waste management. But there is not enough time to talk about all of them. A very important point to consider is to make sure the inclusion of other tests does not overwhelm the capacity of the equipment. Disease-specific departments must also discuss cost sharing and ownership of equipment to avoid any negative impact on the maintenance and repairs. In our case, the decision to integrate tests have put the equipment to good use, and it did not impact our TB results. In addition, we estimated that multi-disease testing resulted in almost $20,000 of savings for the TB program. Usually, the same patient may need different disease sepsis, and integrating tests is a solution which allows for a patient-centered approach. For example, when a woman comes with an HIV-exposed child for EID, in addition to checking the HIV viral load, she can also be screened for TB and HPV. Because cervical cancer is the latest test integrated, I would like to finish giving you some numbers. By March this year, we had done 2,500 HPV tests, which were not easily available for patients before. These are important results only possible by our multi-disease testing effort. Thank you.
Ulendo odiri ndwaorali mwina timachoka kuno kuti kakhakutalawira kwambiri tikaenda pasi timachoka pa sitipiri pamakwana 8 kuluku timakhala tikutani tikuyandikira kumene kuja kuyenda pasi.
Usiku kugona mutu wanga sumagwira tusiti mabwera. Ndimakhala ninkhawa nthawi ndi nthawi ndipo ndinaonda kwambiri chifukwa chokuti moyo wanga nali sanachivomereze chinthucho.
Ndinadziwa ndili ndi zaka 11. Poyambirira ndimaona ngati ndimathera moyo wanga, ndilandira uphungu ndinena zoti simathera moyo wanga ndi chiyambi cha moyo wina.
Ine amunanga nditapezeka HIV positive nditawauza nonso anapita kukayezetsa iwo anadzapezeka negative. Komano chilimbikitso chawo amango ndilimbikitsa kuti iwe uzimwa mankhwala mwa ndondomeko mmene akuzira ku chipatala.
Timanga ndinamba kulumba kumana ndikhazika pasi kuti niyo timano usathamange ndithu umene ndi moyo woyenerera kuti timano ukhale uthamanga mwana Yesu akhoza kuyamwira chani, akhoza kuyamwira kachilombo ndiponso akhoza kuyamwira mkaka woyipa. Kenako timanga namba kukhala pasi nadza kuti andi chitetezo choyenerera chifukwa chake ndabwera kuchipatala kuno kundipatsa mankhwala.
Ineyo ndikungolimbikitsanso azimayi ena amene sanapitepo kuchipatala ndi kukayezetsa magazi kuti akuyenera kutenga mbali kukayezetsa magazi ndi kudziwa za mthupi mwawo atayembekezera kuti akapezeka kuti ali HIV positive ayambepo mankhwala kuti amuteteze mwana amene akumuyembekezera komanso iwo akhale wa moyo wathanzi moyo osadwaladwala ndi moyo wautali.
Ndimapangira zona kuti ana m'Malawi azakhala atsogolola bwino ngati mwina kumamwetsa bwino mankhwala cholinga azakhala ndi moyo wathanzi wautali bwino komanso azakhala ongodziletsa wopewa.
There are over 1 million people living with HIV in Malawi. We have a prevalence rate of 131 per 100,000 for TB and an incident rate of 73 per 100,000 for cervical cancer. And our data shows that 70% of patients with cervical cancer have perished. Note that almost all of cervical cancer death can be avoided when timely screening is available to all. We know now that we don't have to design our national response to control these diseases separately. And this is the biggest learning of all. For instance, at the same point an infant exposed to HIV will be tested for EID, an older man with TB symptoms would be tested for MDR, TB, a woman would be tested for HPV, and anyone with flu-like symptoms could be tested for COVID-19. And the results are delivered immediately. A joint and interdependent national plan with disease testing is possible. We can pool funds together to keep diagnostic services available when priorities change. And we have seen that with COVID-19. It is not simple, but it can be done. As my colleagues from MOH mentioned, with these innovations, we were able to reduce costs and use our diagnostic capacity optimally. This means we service more communities, have better data, and can advance the Malawi health systems in the global health agenda.
The significance of strong and functional diagnostic networks has over the years been proven to be critical for any disease response. We all remember in the tuberculosis response how important it was to introduce molecular testing. In the HIV, we shifted from using clinical symptoms and immunological status of a person to actually measure the viral load in the blood using molecular diagnostics in order to assess whether the treatment actually works. And today, in the context of the health emergency response, everything that we have been investing for years in building those systems have already actually helped us to effectively respond to COVID-19, especially in Africa. The technology evolution itself has also been incredible. Today we can use the same platform or a device to actually test for different diseases, and this both at the central level or in the decentralized way, for example in a district hospital, which means that we can organize the system as such to respond to the individual needs of a person who actually faces issues and faces different diseases. As UNITED, we have been incredibly proud to collaborate with the government Malawi in generating the evidence on these innovations together with UNICEF and CHAI, especially because the evidence coming from Malawi has actually informed global discussions around political considerations or funding considerations, and especially technical consideration of what integration actually means, how it can be done, and to what extent it is beneficial and feasible for a response to any disease. Today, especially in the COVID-19 times, we as UNITED remain committed to pursue the integration principle, and it has been, as I said, at the forefront of the COVID response, and we need to support the scale-up of integration approaches, and I believe that many lessons learned will again come from Malawi, who continues to be our partner on this journey.